Welcome to the NIOS studio. Today we will discuss about lesson 8, communicable and lifestyle diseases. World Health Organization. In short, it is known as WHO. It was formed in 1948. According to WHO, the definition of health is: health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. It means proper functioning of the body and mind. Good health makes us more cheerful, energetic, full of life, more efficient at work, and therefore more productive. There are few factors which affect our personal health. Let's know about those factors. Balanced diet is very important, and food hygiene. Good hygiene. It should be personal hygiene, family, and community. Physical environment is also very important. The environment near our house. Water supply. Access to health services. Cultural practices. Relaxation and sleep. Avoidance of alcohol. Smoking and drug abuse. We have discussed about the factors which affect our personal health. Now let us understand what is a disease. Disease is a state in which normal functions of the body are disturbed and the individual physically and mentally feels weak, lethargic, and develops symptoms of the disease. The doctor usually diagnoses the disease on the basis of the symptoms. The disease can be classified broadly in two types. The first is lifestyle diseases, and the second is communicable diseases. Lifestyle diseases are also known as non-communicable diseases. Now let's understand lifestyle diseases. These diseases develop by environmental factors, including poor lifestyle practices and wrong food habits over a long period of time. These are chronic diseases and leads to poor immunity. These may continue throughout life and need management and medication. What is a lifestyle? The lifestyle is the pattern of living that we follow on regular basis. Examples like how we work, what and when we eat, how and when we sleep, how much physical activity we do, and whether we smoke or consume alcohol. Now let's understand communicable diseases. The disease spread by germs or microorganisms are referred as infectious disease or communicable diseases. These are usually short-term diseases and influenced by immunity. Now we will discuss the modes of communicable diseases. How we get disease, the sources. These sources are food and water, air, contact, insects. Mainly, these four are the modes through which we get communicable diseases. Through air mode, we get flu, streptococcal throat, tuberculosis, pertussis, chickenpox. Through mosquito bites also, we get few diseases like malaria, dengue, Japanese bee, encephalitis. You must have heard a disease named cholera. The symptoms are sudden onset of a severe watery diarrhea. The feces look like rice water. Vomiting, cramps in the legs. Patient feels very thirsty. The cause of cholera is food and water. The incubation period is 1 to 5 days. And the management of the patient. How should we take care of the patient? Dehydration can be dangerous, so give plenty of fluids. Give oral rehydration solution. In short, it is named as ORS. Give boiled, fresh, easily digestible food. Now we will know about typhoid. the symptoms are severe headache, fever with low pulse, dry with coated tongue. Some other symptoms you can see in the picture: high fever, headache, weakness, dry cough, stomach pain, constipation, rashes. How does this spread? The mode of spread is food and water. The incubation period for typhoid is 14 to 21 days. The points we should keep in our mind for prevention of the typhoid fever and management of the patient are: the blood culture and other tests should be done. Give the prescribed medication to the patient. We should wash our hands properly. Drink boiled water. We should clean fruits and vegetables prior eating, and get vaccinated. Now we will talk about hepatitis. Its other name is jaundice. The symptoms of jaundice are fever, dark yellow urine, yellowish tinge in eyes, general paleness, loss of appetite, abdominal discomfort. You can see in the picture color of our body, hand and eye is pinkish and white, but a jaundice patient's eyes and hand and body color is more on the yellowish side. The mode of spread for this jaundice is food and water. The incubation period for the jaundice is 20 to 35 days. How should we take care of the patient suffering with jaundice? We should give a carbohydrate-rich diet. We should keep the patient in bed as long as there is fever, till appetite returns to the normal. Now we will discuss about influenza. Its other name is flu. The symptoms of flu are fever, cold, cough, sneezing, headache and body ache and nausea. The mode of spread is air. Now we will talk about tuberculosis. Its other name is TB. The symptoms of TB are persistent cough, loss of weight and appetite, excessive weakness, rapid pulse, chest pain, breath has peculiar odor. Some other symptoms are coughing with blood, chest pain, tiredness, not feeling hungry, Now we'll talk about pertussis. Its other name is whooping cough. The symptoms of this whooping cough are inflammation of mucous membrane, severe bouts of cough a week accompanied by a whoop-like sound, the mode of spread of this disease is air. Now we will talk about malaria. The symptoms are fever, alternating chill and perspiration, headache and body ache, nausea, vomiting days. The mode of spread is mosquito bite. Now let's understand dengue fever. Dengue fever is also a mosquito-borne disease. Dengue is the name of a virus. That is why this fever is known as dengue fever. It has mainly 3 phases. The first phase is febrile phase. It has sudden onset fever, muscles and joint pains, headache, rashes, mouth and nose bleeding, vomiting and diarrhea. The next phase is critical phase. It has hypotension, pleural effusion, ascites, gastrointestinal bleeding. The third phase is recovery phase. Altered consciousness, seizure itching, and slow pulse. Now let's understand communicable disease. It spreads through contact. You can say skin to skin contact, like lice. Lice are the tiny parasites that live off the blood in scalps. Lice crawl, they can't jump from head to head, which is why they plague preschoolers and preschoolers and kindergartners. Scabies. Scabies are tiny mites that burrow under the skin, lay their eggs and cause a very itchy rash. And the next is sexual contact, like HIV or blood contaminated injection or needles. The other communicable diseases are spread through orophyceal. You must have seen pinworms, Small worms. Pinworms are tiny worms whose eggs can be found in animal feces in the playground. The undernamed intestinal worms infestations Ascaris, Giardia, cysticercosis, amoebiosis enter through oral route as fecal matter in pond or canal water contains egg, cyst, and most of our vegetables are washed in these water sources. So that is why we should wash our food, especially fruits and vegetables, properly before eating them. Washing pests out of vegetables and fruits. Lemon bath. Let's understand lemon bath. Fill sink or bucket with cold water. Add 4 tablespoons of salt and the juice of 1 lemon. Soak for 10 minutes. Then rinse under cold water. Can also substitute lemon with 1/4 cup of raw apple cider vinegar. Another method of washing pests out of vegetables and fruits is Clorox bath. For this, use 1 teaspoon Clorox bleach per gallon of water. Let produce sit in bath for 5 to 10 minutes. Drain. Soak again in fresh water for 5 minutes. Remember, there is chlorine in your drinking water. This is how many undeveloped nations wash their products or produce. Now we will understand the method to prepare ORS. ORS is oral, rehydration, salts, drink. You can purchase ORS packets available in the market, chemist shop, or hospitals. ORS packets are available in health centers or a chemist shop. You can purchase them. Also, you can get them free from the government hospital. Put the content of the ORS packet in a clean container. Add water only. Do not add ORS to any other liquid, juice, or milk, or soup, or any other liquid. Do not add sugar. Add only water. Stir well. In case of infants, feed the solution from a clean cup with the help of a spoon. Do not use a bottle. In case you are unable to get an ORS packet, then you can make it at home. 8 teaspoons of sugar, 1 teaspoon of salt, 1 liter of clean drinking water, These three items are required to make your ORS. First, allow the sugar and salt to dissolve and stir well. Your ORS drink is ready for the patient. Let's now understand HIV. What is HIV? The full name of HIV is Human Immunodeficiency Virus. HIV is caused by a virus that attacks the body's natural defense system or immunity. This virus continues to reduce the immunity and body is no longer able to defend external infectious agents and body is prone to catch many diseases including TB. When HIV virus has completely destroyed the person's defense system, AIDS sets in. AIDS stands for Acquired Immunodeficiency Syndrome. What are the ways of transmission of HIV or AIDS? There are few points we should keep in mind and we should be careful. Sexual contact with an infected person, exchange of infected body fluids, example, blood transfusion, use of infected needles from infected mother to a child during pregnancy or at birth. Also, we should remember and we should understand that AIDS cannot be spread by shaking hands, kissing on the cheeks, using the same toilet seat, standing close to the infected person, through the air, that is sneezing, coughing, through cups, glasses, plates, through water or food. There are some preventive measures for the HIV. As we all know, there is no cure for HIV or AIDS as yet, nor is there any vaccine to protect people. So, restrict the number of sex partners to one. Use protection during sexual contact. Always use only properly sterilized needle for injections. Insist on getting properly tested blood from registered blood banks when in need of blood transfusion. Seek medical advice for bearing a child if infected with HIV. It is important to understand that HIV infection and AIDS are related terms, but not the same. HIV infected person may be suffering from AIDS. It means an HIV infected person, if takes a nutritious diet and maintains a healthy lifestyle, can deter the onset of AIDS and can lead a productive life for a number of years. Now let's understand lifestyle diseases. What do you understand by lifestyle diseases? As the name itself suggests that the outcome of defective lifestyle, such as faulty diets, eating more sugar, more fat, smoking, and lack of exercise, diseases like diabetes, hypertension, its other name is high BP, high blood pressure, obesity, and heart diseases are lifestyle diseases. They are also called non-communicable diseases. In brief, the other name is NCDs. Lifestyle diseases are defined as those health problems that react to changes in lifestyle. All lifestyle risk factors have one common property. They make breathing heavier and body oxygen low. Cell hypoxia or oxidative stress is the driving force of lifestyle disease. Now let's understand how to care for the sick at home. First of all, we should consult the doctor immediately instead of waiting for the intensity of the disease to increase. We should follow the doctor's advice. Whatever medicines are prescribed should be given on time. Give the patient a proper and balanced diet as advised by the doctor. See that the patient takes adequate rest. Keep the patient's room clean. The patient's clothes should be changed every day and he may be given a sponge bath if possible. In this picture, you can see and understand balanced food for diet. A sick person should eat a balanced food, as vegetables and fruits provide vitamins, minerals, and antioxidants, which are good for our health. Also, the water should be clean. The chlorination of water is important to make water clean. This is one of the highly effective methods of killing bacteria. It prevents cholera, diarrhea, and typhoid. It also prevents chlorination of water also prevents hepatitis and polio. Also to some extent protozoa and helminthes also. So we should live healthy lifestyle by eating the right food, physically keeping our body active. We should walk 40 to 60 minutes daily or do some physical activity on regular basis. Maintaining a healthy body weight. No alcohol intake, no smoking, and oral hygiene. I hope you must have understood all the points we discussed in this video. You also must read your book, study well, work hard. Thank you so much.